and we will dry out, as we have seen this time with APIs, because the global supply chains get disrupted. And that is where we want to, I think, build the local knowledge. I mean, we are working in Nigeria in that space, for instance, and I think that is very interesting and has huge growth opportunities as we look forward. The last one amongst these points is the retail distribution side. And here I would say the key things, again, to look at is how can we help grow consolidators. And I mean, we supported, for instance, Good Life in Kenya, but again, you don't only create a platform, you also help align the standard, make a uniform standard across that retail and distribution kind of axis. I will close. I'm getting a hint that I should come to the end. We're saying the other area which I really find interesting and where I see a lot of cross-fertilization of ideas is in medical equipment. So there, for instance, we created a platform which we roll out in Kenya with CoBank, in Cote d'Ivoire with NSI Bank, where we provide kind of loans to health SMEs that they can purchase the medical equipment that is required to equip their, be it a small clinic, be it a diagnostic center, etc. And I think that is, again, a tripartite arrangement together with OEMs like GE, like Philips, like Getinge, like Storz, where really we try to make a kind of a leapfrog jump to provide more of that in the region. And I think similar approaches could be replicated in other areas. So with that, I will perhaps pause and again, thank you, Egbe, for having given me the opportunity to open this up. I look forward to a very, very interesting discussion, and thank you all for your interest in really this very, very important theme for the continent. Thank you so much.
Yeah. Thank you so much, Olaf. I mean, that's a really wonderful way to start. And if you're on for a few more minutes, I'm sure during the questions and answers, there will be questions for you. So if anybody does have questions for Olaf, or comments or suggestions for the IFC in general, please feel free to put them in the chat box. And now I am very excited to welcome from Akwa Ibom State in Nigeria, the Secretary to the State Government, who has kindly agreed to, who's representing His Excellency, Mr. Udom Emmanuel, who's unable to be with us this morning. Dr. Ekwuem is a PhD in electronic and electrical engineering and knows all about telecoms and the private sector. So I'm not sure we could have asked for a better person, that will be talking about the role of government and the role that Akwa Ibom has played in sort of providing the environment to have the largest syringe factory in the country. Dr. Ekwuem himself is an engineer, is a fellow of Computer Society of Nigerian Computer Society, the Society of Engineers. He is on the Infrastructure Summit group. But for us, particularly in healthcare, he he was the chairman of the COVID-19 Management Committee in Akwa Ibom. And with his excellency, the team worked very closely to stem or control the issue of COVID-19 in Akwa Ibom, sort of early in the pandemic. And so I know that if I was going to talk about Dr. Ekwuem, it would take a long time. And because we have limited time, I really would like to hand over to the SSG, who will be given a couple of remarks from the government's perspective. Thank you so much.
Yeah, thank you very much. I appreciate this opportunity to represent my boss, the governor of Akwa Ibom State, Mr. Udom Emmanuel, who strongly directed me to be here to represent him. So I'm happy to be here. And I'm happy for the brilliant paper presented by the last speaker. Let me come to Akwa Ibom State. That's the full name of the state, Akwa Ibom, God Almighty State. Long before COVID-19, the governor had decided in the Executive Council that we were importing syringes, in Nigeria, and no company was manufacturing syringes. And this is an important component in terms of delivering the right services in the health sector. So the government backed upon partnering with the private sector. This is the point. No government funds in attracting the largest syringe factory in Africa. And I can tell you the total number of young men and women who work there, the workforce, more than just less than 200 who are currently working there. And each time I'm in Lagos and Abuja and I see our syringes, the Jubilee syringes being used, that gladdens the heart, not necessarily because of the money that we are earning thereby, but because of the fact that this can be done locally. I was observing what was presented by the last speaker, healthcare providers, pharmaceuticals, and medical technologies. I like the way he put them in the three components. And in the area of medical technology, we take it very seriously. Number two is you remember at the peak of the COVID-19, when the NCDC came on a visit to Akwa Ibom State, we put up our quarantine sector, the isolation center in just 1 month, from bush to 300 bed space isolation center, using the pieces of technology that we had in-house. One would say the governor foresaw COVID-19. No, he did not, but the governor worked assiduously to make sure that health, being wealth, was taken care of seriously in Akwa Ibom State. And that was the reason. So all the ventilators, the things that the countries were even looking for, some states were looking for, we had, as you remember, even at that time, 19 in Akwa Ibom State. We were already stocking this because the governor believes, not just that he believes, he works it every day, he works the talk, that health is wealth. So if health is wealth, so health creates wealth. And when you have wealth, wealth in turn creates health. What? Technologies, because you have wealth, you're able to invest in other areas of health-related enterprises. So that's what we did in Akwa Ibom State, and that's what we are still currently doing. Three has to do with the policy framework, the corporate governance, the structure, the interest of the part of the leadership. There's what my father used to say, my dear. He used to say that no household, no town, no city, no state, no country can be better than whoever is at the top. So it's the top, whoever the top is, that permeates the entire substratum. So the governor, in his good wisdom and good counsel, decided that, look, let's get these things done. So we have at the peak of the COVID-19, and even within the hospitals, we have 10 remodeled general hospitals with a lot of local technology that we use. And important was, just like we're using Zoom now, you can see, I'm seeing you, good looking, graceful lady, I'm seeing you, I can almost touch you. So that applies to even in the medical industry, in the healthcare industry. Do you know that of the 10 general hospitals, doctors in one hospital, by simple technology, 3G, which we use in COVID-19, a medic who has an experience, maybe he's a gynecologist, or he's a pediatrician, or he's a psychiatrist, is able to be in one hospital and puts his expertise via simple Zoom connectivity to another general hospital. You wouldn't believe that. It's not millions of dollars. It's not. Simple Nigerian Naira, we're able to connect one hospital to the other. Simple 3G and Zoom for the medic to put his expertise at the disposal of patients in another hospital who do not have that kind of expertise. Just simple technology that we adapted or we applied in the healthcare sector. Thirdly, has to do with the populace itself, the Akwa Ibom State citizens, their sensitivity to accepting what government has put in place, what the government is trying to do. And that this has to do with the public awareness of the intent of government. When you said came here, I'm sure you read it in the social media, rated us very, very high because of the spontaneity with which Akwa Ibom State government does things or reacts to things that pertain to public health and to the health of the ordinary citizen. So we do this on a routine basis. In fact, during COVID-19, we were working in this room. This was our COVID-19 briefing room where I am. Only that we had at that time a banner here, COVID-19. We stay here till 1 a.m. The governor himself will be part of the meeting. word by word. We have 329 words in Akwa Ibom State. And we use WhatsApp, Zoom, video clips to do that, to know what was happening in any of those places. So adaptation of technology as they are, not rocket science, to improve healthcare delivery system matters. And that has to do with the confidence with which the citizens have. For example, we in government, we have to be seen as patronizing the healthcare delivery system. I go for routine medical checkup in a multi-specialty hospital, very advanced hospital. And when another appointment sees the secretary of the government, he's being treated, or he's being examined by the medic, he's sphygmomanometer, he's taking my pulse rate, he's taking my oxygen meter, and I'm going through maybe CTI scan and all that. It builds confidence on the part of the population, even the governor, the deputy governor, the secretary of the government, the speaker, that would patronize the hospitals that are available and rely on the locally available technology. So my message upon here is that some pieces of technology required for efficient healthcare delivery system and to organize it well within the state. It's not rocket science. It's just about using what is currently available and using them very efficiently. Lastly, it has to do with the corporate governance structure, the transparency and accountability. Resources disbursed must be seen to have been put to good use. My governor, as you know, is a financial services person. So for him, every cover must count and every cover must have value. And if you do not monitor to have proper checks and have a monitoring mechanism to know that what was intended is what you actually realizing, and it becomes all the more difficult. But once the public sees that what was intended is being realized, it builds public confidence and public trust in the process and in the system. So that has been the way the governor leads a healthcare delivery system with the right policies, good corporate governance structure, patronizing local technology, adapting them, applying them to get maximum results in Akwa Ibom State, and making sure that we partner with foreign entities to do those bits that we cannot source locally. So the gentleman that presented the paper, look forward to partnering with him via you on the area of medical technology and what he called digital health. I saw the part of his presentation on digital health. So thank you. Those are the few words of comments that I can make at this time or this part of the presentation. Thank you.
Thank you very much, SSG. I learned today the full name of Akwa Ibom, Akwa Basi Ibom State.
Ibom, correct. God
Yes.
Almighty State.
I did not know this. So as a fellow South person, I am very happy to now know what's the full meaning of Akwa Ibom. So thank you so much. And this is really very helpful. There are many congratulations. I mean, to actually have created a syringe factory before the COVID, I mean, that was real foresight. So thank you so much for sharing your experience and from the government's perspective on what's needed to support the private sector. I especially note the fact you said 100% privately owned, independent, government not directly interfering, which I think is the kind of things the guys in IFC like to hear. So thank you so much. Jamie, can you put up the one question on the survey? Co-host, please don't answer. Jamie, can you put up the question? In the meantime, as Jamie is putting on the question, I will introduce guest speaker, Dr. James Rice, or Jim Rice, as he's known to several folks. And we're very fortunate to have Jim, who is one of the world experts on governance in healthcare, and led some of